But we start following breaking news here. Governor Lamont announced that he has now tested positive for COVID-19 today. Thanks for joining us for the news at 4. I'm Ben Goldman.
And I'm Jen Bernstein. The governor breaking the news on Twitter today, writing that he is not experiencing any symptoms and that he'll be isolating over the next few days, continuing to work from home. He says he looks forward to getting back to the office. Lieutenant Governor Susan Bysiewicz said the governor is doing okay.
He and I talked. He is feeling well. He is asymptomatic.
Well, the news comes amid a slight uptick in COVID-19 activity across Connecticut. Today's positivity rate standing at 4.88%, and state health officials say the subvariant might be to blame.
Fox 61's Carmen Chow joining us live in studio now with more. Carmen.
Ben and Jen, Governor Lamont announced on Twitter this afternoon he has tested positive for COVID-19. He did get his second booster shot last week, and this comes at a time when there is a slight uptick in positive cases from the subvariant. And despite this, the Department of Public Health is now changing how often they release COVID-19 data. Just 1 week ago, Fox 61 was there when Governor Lamont rolled up his sleeves to receive the second booster shot. Today, the governor tweeted this, announcing he has tested positive for COVID-19. The governor's director of communications releasing this statement saying, quote, "He's feeling good and not experiencing any symptoms, and he is grateful that he is receiving protection from the second booster shot he received last week." It just so happens there has been a slight uptick in COVID-19 cases, which experts say could develop into a new wave of cases based on what we have seen in Europe and Asia. But Dr. Thomas Balsazak of Yale New Haven Health believes there is no reason to panic for now.
The temperatures are going up and the humidity is going up. We'll see less transmission. We are by no means out of the pandemic. And we remain ready to take care of future surges.
Like Governor Lamont included in his tweet, it is still encouraged people get vaccinated and boosted. As more subvariants develop, the virus will always target the most vulnerable and immunocompromised populations. But what is different this time, according to Dr. Manisha Juthani of the Department of Public Health, is the number of resources.
We also have oral antivirals that are more readily available. These are two things that we have in our toolbox that we didn't have before.
DPH now changing how often they release COVID-19 data. Instead of every day, it will be over a 7-day period. Yale New Haven Health CEO Christopher O'Connor agreeing with this change.
That data was critical because we had resource allocations and challenges that we needed to contend with, and it was a planning tool. That is not the case right now.
The focus would be on the trend over the week instead of what has happened in the last day, which can vary significantly up or down and misrepresent what is going on with the metric.
I think the infrastructure that we've built, it's a dial. We can turn it up if the need arises.
And it's not just Connecticut cutting back on daily COVID-19 reports. According to the New York Times, approximately 9 states have shifted to reporting data either once or twice a week. Carmen Chow, Fox 61 News.